Casey Cagle made history last November when he became the first Republican elected Lieutenant Governor of Georgia. He was raised by a single mother, built a successful business from the ground up. An underdog in his campaign, Casey Cagle is very familiar with challenges and how to overcome them. Today he will speak to us about the future of health care in Georgia, an issue that affects us all. Ladies and gentlemen, please welcome Georgia's Lieutenant Governor, Casey Cagle.
Great. Thank you very much. I've got a support crowd back there that stood up for me. I appreciate that. We actually had to bust them in from Gainesville to do that. But it is a great honor to be here with you today. And I'll tell you, I'm very impressed with the turnout. Certainly you couldn't ask for anything better. And, you know, as Mark just mentioned, that we did make history by actually being the first Republican lieutenant governor in the history of Georgia. And as I was talking to the group here at my table, you know, coming before the press club and being willing to answer all of your questions is kind of like taking on Ralph Reed in a primary in the Republican Party. So, but making history does certainly excite me, but the chance to write history is even more exciting to me. And this is today a very special day to really come before you and talk to you about health care. I know it is such an important issue to you, and I want to say at the outset, as we began to analyze Georgia and look at all of the issues that needed improvement, there were so many, education being a big part of that. Of course, this past session we engaged on that issue and brought two very strong initiatives to the table that I think has great promise for our state. But also, we have to focus on health care and transportation. When I think of health care, there are so many issues to try to get your arms around that I want to say at the outset, I'm not the son of a physician or a managed care provider. Are you understand? So, but we were able to really gather a lot of information. And so the process by which I go through in trying to determine really the direction to move the state in relative to public policy is to really gather a lot of facts. And really the findings that we looked at is certainly the rising cost of health care, but also the uninsured population in Georgia as well. We all know the real statistics relative to the rising cost of health insurance. It's skyrocketing. Nationally, the total health care costs are estimated to be over $4 trillion by 2015. The U.S. average per person expenditure for health care is $6,401 in 2005. Small businesses can no longer afford to insure their employees as a result of the rising costs that are associated with it. Individuals sometimes have difficulty garnering the information to make an educated decision relative to purchasing insurance products. There's really no direct link between healthcare providers and healthcare consumers. And so we really looked at it and tried to analyze that issue, but also the uninsured population. We recognize that there are 1.7 million people that are uninsured in Georgia today. 21% of the population in Georgia are uninsured. Those are staggering statistics when you look at it. You also look at Georgia being ranked 6th in the nation in increase of uninsured population, a statistic that none of us are very proud of. 71% of the uninsured are working adults or their dependents. The cost to treat uninsured in Georgia last year was $1.5 billion, cost borne by all of Georgians through cost shifting, as we're all aware of. An average family of three with private coverage pays about $969 a year to pay for uninsured. Those are real numbers. And you look at emergency rooms today, and you see that the number one reason that a person goes to an emergency room is an upper respiratory concern, a cold. You know what the average cost in Georgia to treat that cold is here? $1,400. You could go to your primary care physician and probably get it taken care of for $100. Those kind of environments that we see are troubling. 20,000 Georgians visited ERs this last year for dental concerns. Those have a huge impact on the cost of delivering health care. I believe that there are really three factors that must be present to lower cost of health care. Number one is a network delivery of care at the lowest cost to consumers. The second is a maximum competition within the marketplace. And the third is consumers in charge of purchasing. As I analyze the statistics in the marketplace as we know it today, I believe by and large those three components are absent to our strategy. And so we set out really to bring about real solutions to the issues at hand. Those solutions really we unveiled today as our two healthcare initiatives that we will be moving forward in the legislative session this January to promote. The first is the safety net clinics. We all know with the cost shifting that derives from emergency room and individuals that are going to the emergency rooms as primary care physicians opposed to triaging them into more affordable health delivery strategy environments is having an impact on the cost. So how do we do that? And my thought is that we create the clinics that really create a public-private partnerships to where physician groups can be involved as well as hospitals and not-for-profits and our public health environment to where we come together in a grant process to where the state participates and will end up allowing people to really put proposals together and authorize 5 of these safety net clinics that are very similar to the free clinic network that already exists in Georgia. Partnering with that and using the state resources and state dollars to participate in that, as well as exploring even additional options like a voucher for an individual that may be showing up to the emergency room and is not and needs to be triaged into another environment. When we look at the delivery of this health care, so oftentimes a person may wake up in the middle of the night with a concern, a health care concern. The only option that they may have available is to go to the emergency room. But those that are uninsured ultimately don't have a lot of options. So how do we allow the delivery of services to be granted throughout the state in a more efficient way and triage them into those areas is going to require the public-private partnership that we're going to propose in the safety net clinic. And I believe very confidently that by focusing and bringing all of these resources together, that we can create that model that will work and ultimately deliver the care and the service that individuals are going to need in this environment. The second thing that is our initiative is the Georgia Health Marketplace. And I will tell you that I believe very strongly that this exchange has great opportunity. When I talk about this issue, I want you to first of all, think about someone that you may know. It may be your mother. It may be someone that works with you or that you work out with at your gym. If today they're looking to obtain insurance, where do they go? Most of the time, they go to their employer. And if their employer doesn't offer that insurance, then where do they go? So my desire is to try to create more competition, more products, more options in which individuals have the ability to access the degree of insurance and coverage in which they need. And what the healthcare market exchange will do is it will actually create an authority that will be run by a state entity that we will create during the legislature that will be made up of state officials as well as appointees by the governor, myself, and the speaker that would be made up of industry individuals. And so providers will be able to put on the exchange, like a commodity, the ability to offer their products to where consumers can be directed there and actually purchase a level of care in which they may need. I believe that more consumers are looking for the ability for them to control the purchasing power. And I think if we want to see reform in health care, we've got to empower consumers to get more active in the purchasing and directing the marketplace. And this is an ability by which we can do so. I believe that the exchange can really offer not just the Peach Care coverage that we currently offer, but also the new program that the governor has just brought forth, the Georgia HIP program, but also traditional type coverages that all the state licensed providers in Georgia are already offering. But I want to introduce two innovative things that I think will really change the way the market is derived. And that is to allow physician groups and hospitals to have some direct ability to contract with consumers to provide coverage. We've already saw some of this in the marketplace with some success. And I believe that more physicians, given the opportunity and the venue that they can access to the consumer, will only allow more competition and allow people to have more choices relative to the decisions that they make relative to health care. There are so many people today that if you're a younger person, and when we look at the uninsured population, we recognize so many of them are from 18 to 29 years old. They feel invincible. Why do I need health insurance in a traditional format? Well, the truth is they may not. What they may need is a basic preventive type care of health insurance with a catastrophic binder over the top, an umbrella. That type of policy ultimately is not accessible and offered in a way that we're talking about being able to offer today. So we want to introduce more opportunities, more flexibility, but ultimately allow the consumers to be in charge and have the safety net for those individuals that are 300% in poverty or below, to where they can access the safety net clinic in a co-pay environment that really promotes responsibility but access to the basic care. We know that the mandates associated with health insurance today have a cost driver associated with it. We want to offer within the menu and the exchange to allow a very basic free mandate policy that allows consumers to have that choice to the marketplace to provide whatever health care needs that they feel are important to them. It's portable. It allows the consumer to go purchase it, and it allows them to also, through a creative way, to do some of this with pre-tax dollars. There is so much innovation within the internet, within technology, and we want to unleash that relative to health care. And I think that as we go down this path and we put the pieces in place, it's going to allow access, better access than we've ever had before, and meet the needs of the consumers. And at the end of the day, that's what we're all about. I applaud the governor for his initiative that he moved forward with on the 3-share plan. I think that those are innovative options that we can plug in to the authority and the exchange that will ultimately promote more access to affordable health insurance as we move forward. With that, I'm going to conclude our remarks and open the floor up for some questions at this time. Before I do, I think it was passed out formal comments that are there, and I just hit the highlights here today because of the time restraints in which we had. But also there's a little bit more of a detailed proposal of both initiatives there. So with that, we've got a question back in the back. Well, that's a pretty broad question. And when we talk about Peach Care, the CHIPS program has been a huge success, not only in Georgia but all across the country. And we recognize that so many kids need the ability to access care, and the Peach program has met those needs. Right now, it is at 225% of poverty, and which is really greater than what has been authorized currently under the federal law. So we have a very aggressive policy in place that allows more kids to not just access basic type health care, but also the dental and the vision that's a part of that as well. I've been a strong proponent of Peach Care, plan to continue to be. If the reauthorization moves forward in Washington that raises it to 300% of poverty and allows adults to be added to that, we will look at it and try to assess what is in the greatest degree of need in our state and how we meet that in an efficient manner, but also that promotes responsibility. I'm not interested in more and more government entitlement programs, but I am interested in taking care of the truly needy within our state, and there's a balance that's associated with that. Right here. I'm sorry, I'll let you pick the one that gets to ask the question. Unless you have the microphone.
How does this health care proposal impact the issues facing Grady Hospital, and what role do you see the state playing in the next session in helping out Grady Hospital?
Well, Grady Hospital, as we all know, is run into significant financial difficulty. And I am one that believes that they're not going to be able to just simply borrow their way out. I personally believe that new governance needs to be put in place in order to be functional and offer product lines that are going to generate more revenue dollars to the bottom line. That model does not exist and cannot exist under the current structure that is in place. I have been very, very vocal and very concerned that there has not been a proper action relative to putting the proper governance in place to sustain the financial viability of Grady. And in order for the state, from my point of view, to be proactive in being a partner with Grady, the governance is a prerequisite for that to occur. I am hopeful that within the governance of Fulton County and DeKalb that they will embrace this issue and understand that that's the only resolve that they have to pull themselves out. If they continue to loan money or give Grady money, it's not going to be able to pull itself out, and they're just going to delay the inevitable. So I believe that they need to get busy about the governance. This program is a program that obviously every consumer in Georgia can access, and we believe that it will be very proactive in helping not just Grady but all of our hospitals in Georgia.
Thank you. How will your program work in rural Georgia?
Well, rural Georgia, the dynamics oftentimes are very different there in terms of access to care. We recognize that we need more physicians in rural Georgia and that we need more primary care units there. We believe that the safety net clinics, as we promote 5 of these as a pilot program, and if they continue to do well, we actually take this and roll it out statewide. I believe it can have a tremendous asset to rural Georgia. And then as we talk about empowering consumers and giving them more choices relative to the purchase of their level of care, this will certainly help rural Georgia as we talk about access to care. I can visualize a day in which physicians become, more proactive to take care of those preventive needs on a cash-type basis, and then individuals have a catastrophic policy as an umbrella over that, and becomes very, very affordable. I know that there are some similar type products that insurance companies are offering here in Georgia now that you see a significant reduction in premium cost when you access that. So today is a day of innovation as we talk about health care, and it's for not just the metro area, but it's also for the rural part. It is a question of access and educating consumers to give them the best choices available to meet the needs of their family.
Lieutenant Governor, just for clarification on Grady, you're saying that the loan that's on the table right now, you would not advise Fulton County and DeKalb County to co-sign on that loan? And can you clarify what you mean by new governance? Are you saying that there should be new members on the authority that run Grady, or can you go into depth about that?
Well, I would say to Fulton County and DeKalb, they obviously are a local governing authority, and they derive their taxes from the consumers that shop, as well as the property owners that reside in their jurisdictions. If that is a choice by which their constituency wants to choose to continue to put $100 million a year into Grady, then that's their choice. But they do not have a financial model, in my view, that will be sustainable under the current governance that is in place. And I applaud the chairman of the Fulton County as he has embraced this issue and understands that there needs to be financial discipline applied to Grady. There needs to be a new model for business, and ultimately meeting the needs of the consumers in which they serve. We all know that they are vital to not just Metro Atlanta, but the entire state. They're the only Trauma One center that we have. They do a phenomenal job in providing that level of care. It is a service that would be sorely missed if we lost it. We've got to ensure that Grady survives and has their financial sustainability plan is in place. And right now, under the current governance model, it will not exist. They need to change to a model that is ultimately a not-for-profit organization that's very similar to all the other not-for-profit hospitals that exist here in Georgia that are providing great levels of care, but also managing their finances.
We have a question in the back.
Okay.
Governor Cagle, I want to thank you for being in Perry, Georgia on Tuesday. I'm David Allen, a retired provider and the current chair of the Georgia Chamber. What Governor Cagle has said this afternoon is right on. It's like a rifle shot. It's not a shotgun blast. Casey, you are educated on the facts. Mr. Eves needs to be complimented, and Mr. Jones needs to follow his ideas. But if Grady fails, I guarantee you the trickle-down effect to all the other hospitals is going to be horrific. Sure. So I hope we don't have to wait until January or February to get this fixed. I'd love to see us get it done come September. And thank you for everything you've done for us, Casey.
Great. Thank you, David. That was an endorsement paid by Casey Cagle. No. I'm teasing. All right. We've got some questions down front, although these are the ones that are closest to me, so we may not want to allow them to ask a question. I'm teasing. I want you to just stand. Well, I guess people in the back can't hear. All right, there you go.
Sure. Back on Grady, to what dollar extent, if any, should the state support Grady if the governance does change?
Well, I would say that right now, under the current strategy, the state is putting a significant, and when I say significant, is very large financial contribution to Grady. The majority of the patients that are being seen there are paid in some way by state and federal resources. So it is a huge, significant financial contribution that Georgia is already making. To the point of being able to give them further assistance, I believe that there are mechanisms by which we can do so. And some of that may be the utilization of some advances on existing billings that will help bring forth some cash at a faster delivery pace. There are other avenues that we can explore, but you don't want to put money into an environment that is not going to be able to sustain itself long term. And until that plan is forthcoming, I'm very concerned about putting in additional revenue.
Lieutenant Governor, should Grady reduce the services that it provides to the public and thereby scale its model down?
No, I don't know that that's necessarily the answer. I don't want to get into a micromanagement of Grady. That's not the role of the CEO or the and my point of view is that right now there are not profit centers by which they can engage in like other not-for-profit hospitals do. I mean, if you look at Memorial Hospital in Savannah and you look at the demographics that exist relative to the services that they provide to the consumers, there are some similarities, okay? You've seen many hospitals, not-for-profit arms, that have struggled greatly over the years, that have begun to make some structural changes, become more efficient, and utilization of more services actually have come about. There's no reason why a lot of the profit centers that other hospitals are providing could not be provided at Grady, but because of the structure, it doesn't exist. This gentleman back here has been aggressively holding his hand up. I don't know if I want to answer his question if he's that aggressive, but I'm teasing.
Thank you.
Some of these people ain't got to know my humor yet.
Two questions. One is with clinics, if patients are seen in a primary care clinic, but they have a problem like they have a little mole that's changing color, they need to be seen by a specialist. Otherwise, it can spread. The disease can become very expensive, and they can die and suffer. And they're throughout the state, except for Grady, where they have 200 of these specialty clinics. They're like dermatology, cardiology, nephrology. There's nothing available for those people. Mm-hmm. So a lot of them, unfortunately, have their disease spread, and then they become...
What's your question?
Well, I think
I think he sees what I'm asking, and I had one other question, if you please won't take the microphone away. Thank you.
Okay, well, go ahead and ask your second question. I think I can remember it first.
The second question is in reference to insurance coverage. Mm-hmm. Unfortunately, many insurance companies make their profits by offering insurance coverage, but then when you need it, they don't cover certain things. And it's very frustrating for physicians when that happens. And they have been successful in getting Congress to pass legislation where they can't be sued if they don't provide certain...
All right. Well, you're digging in big wells here. I don't know that we're going to have enough time for all of that. But let me just say, relative to Grady and really any other hospital, is that we recognize that specialty clinics as well as services that really pinpoint on specific areas of practice of medicine is important. It's very vital, and we have every intention in allowing that to continue to exist. We're not interested in scaling back the delivery of any type of service relative to health care, but we are in favor of allowing consumers to be in charge of what they purchase and ultimately being able to drive the cost relative to that. I think that's the American way, and we should always promote that. Now, back on the other, that's a very complex issue that is far bigger than we can really get our arms around right now. But insurance providers or providers of insurance coverage play a very vital role, and there is a risk and a reward associated with their business model, just like any other business. And there needs to be truth associated with the coverage, and consumers need to be educated in what they're electing to purchase and what degree of coverage they're going to receive as a result of that. I'm confident that the healthcare marketplace exchange will promote that, because it will be very clear and legible for individuals to go to and understand what it is they're purchasing and how much it's going to cost at the end of the day. And I think when you educate consumers, they will make the best choice of delivery of health care.
Forgive the ignorance of this question, but how does your plan tie with something like a health savings account where people have control of their own money?
Well, that is one of the menu items in which they will have the opportunity to participate in is a health savings account plan. And so they would be able to, through the exchange and through the authority, would be able to actually manage that through the web. And they would be able to also purchase the catastrophic type plan in which they would need. So in other words, a health savings account would be, I will take care of all of my out-of-pocket expenditure for the year on my preventative care up until a certain level, and then that new policy would kick in over and above that level. High deductibles or other ways in which you can do the same type of policy or a similar type policy. The preventive care that you contract for on the front end, that's a very basic level. All of those are more menu items that allow consumers to ultimately choose what type of coverage that they want and what they're willing to pay for. And it's a real driver in the cost of that coverage.
Great. Microphone.
Just hold it. Yeah, just talk, I think. You're fine.
Yes, but you're.
I have a personal concern that didn't make the press much and kind of frustrates me. Not too long ago, there was an attempt to bring this new type of cancer hospital to the state of Georgia. I'm a scientist by degree. I understand what's going on. And it's needed. And yet, our hospital structure, somehow behind the scenes, snuffed it out from the governor and I guess from you as well, because it was part of your program to bring it up. And it's something about certificate of need. The people need care for cancer, which is obviously a major killer. Where did I'm probably asking an embarrassing question, but who stopped it and why was it stopped? Because it was a very positive thing for the citizens of Georgia.
Right. The gentleman is referring to the cancer center that obviously had a strong interest in coming to Georgia. As all hospitals, no matter if they're an existing hospital or a new formation hospital, has to go through what's called the certificate of need. And that process is in place in Georgia, and it's there because there is a huge burden that hospitals provide relative to taking care of the indigent. As you know, federal law mandates to a hospital that no matter what person walks through the door or the ability for them to repay, they have to treat that patient. And if they have to treat it at their cost or absorb all the cost as well as the physician, then they do it in an emergency room setting. It's mandated that those emergency rooms are open 24/7. And so a long time ago, certificate of need was put in place as a barometer that would be used to ensure that there's not over-competition and that people are able to provide that level of service and make an amount of profit to sustain the hospital running. That certificate of need has been in place. There was a lot of discussion throughout the year to repeal the CON or monitor or modify the CON process, and without any success. The issue of the cancer center, they would have to garner either a CON that allowed them to immediately begin business or go through the application process just like any other hospital would have to provide that level of care. And they were not successful in doing it. Now, I don't know that they won't be back next year to attempt to do so, but it is a process that everyone has to go through, and no one was singled out in that attempt. But I will tell you, relative to cancer, you're exactly right. There is a huge need for a greater degree of service in meeting those needs. I believe that we have some of the greatest physicians and centers here in Georgia already that are making great strides in doing some very innovative things, Emory being a perfect example of that.
Our hospitals just don't have some of the equipment that they have. So from the standpoint of me who might get cancer today, I would go to the nearest one of them. I
There's no question that they provide a wonderful level of care. I would disagree that they're doing something that is on the cutting edge that no one else is doing in Georgia, but they are certainly providing a wonderful level of care that consumers should have the option, of purchasing. And the majority of their patients would not be Georgia residents. They would be coming from all over the world here to Georgia to actually receive this type of level of service. Great. Thank you very much.